Anatomical position is standing with your feet slightly apart and your palms faced forward. This position is going to be important, especially in the next slide. This picture here shows the anatomical landmarks or body regions that we need to know for this course. I'm not going to read through all of these, but you're responsible for matching a body area to an anatomical term or a landmark. For example, if you're given chin, we should know that would be the mental region. If you're given knee, well, that would be patellar. Back of the knee, popliteal, and so on and so forth. So there's a lot here for you to memorize. You can make flashcards. There's a lot of resources on Blackboard where you can practice these, but these are going to be important to know for lab and lecture section. A couple be carefuls. Sometimes the front of the body has a different name from the back of the body, and you saw that with the knee area. You'll see that in the lower leg, where crural is the shin, sural is the calf. So you'll have a lot of practice with this, with our resources, and your responsibility to learn these body landmarks or anatomical regions. When using directional terms, it's important to picture someone in anatomical position, and you can see she's standing, facing forward, palms forward. That's anatomical position. So let's go through these terms. Cranial versus caudal is the same thing as superior versus inferior. Superior is towards the head, or cranial is towards the head. Inferior or caudal is away from the head or down towards the lower portion of the body. These can be used interchangeably. Anterior or ventral is the front of the body. Posterior or dorsal is the back side of the body. Medial versus lateral. Let's use this picture. Medial would be towards the midline of the body, where lateral would be out towards the sides. Proximal and distal, use these down the limbs. Proximal is where the limb attaches to the torso, in this case the shoulder joint. That is as proximal as we can go, where distal would be towards the tips of the fingers. You can do that in the lower extremity as well. So let's fill in a couple blanks. The head is blank to the navel. Well, the head is above the navel region, so we can use superior or cranial as an answer there. The head is superior to the navel. Let's do this one. The thumb is blank to the fifth digit, or the pinky finger. Well, this is where anatomical position is real important, because we know that the thumb is further to the side when the body is in anatomical position. So therefore, the thumb is lateral to the pinky finger. The face is blank to the shoulder blade. The face is blank to the shoulder blade. Well, here we have two options. It's further towards the front, so we can say anterior. It's also higher up, or further up into the head region, so that would be superior. So there's lots of ways we can use these directional terms. One that's not listed here that might be important is superficial versus deep. Superficial is on the surface of the body. For example, the skin is as superficial as we can get on the body. And as you go into the body, you're going deeper, like into the muscle layer, fat layer. Those would be deep to the skin.